Mississaugas as a credit, and these lands are subject to Treaty 13 with the Mississaugas as a credit and continues to be home for many First Nations Métis Inuit people. So today's scheduled speakers include the Honorable Patty Hajdu, Minister of Health, Mr. John Tory, Mayor of Toronto, and Dr. Eileen de Villa, Medical Health Officer for the City of Toronto. And I also wanted to thank some of my Toronto MP colleagues for joining, James Maloney, Adam Vaughan, and Nathaniel Erskine-Smith. Thanks for joining us today. Today's event will begin with remarks from Minister Haidu, and then there will be media question and answer session following the remarks. Nous tiendrons une séance de questions et réponses avec les médias à la fin de l'événement. Media wishing to ask questions can do so by using the raise your hand function on Zoom. And now I get to turn our attention to our first speaker for today. I'm really excited to be able to welcome her for this announcement because I know it's very important to our city. Minister Haidu, Minister of Health.
Well, thank you so much, Julie. And of course, like everyone else, I would love to be with you in person, but it is great to be here with you nonetheless virtually. And I'm speaking to you from the traditional territory of the Anishinaabe people of the Robinson Superior Treaty area and home to many Métis people who have contributed greatly to our region as well. And it is an honor to live and to work in this area. And I am so thrilled to be joined by you, Julie, a passionate advocate for your community and a longtime community advocate. Also, I would say a fierce fighter for equity and social justice. And I have to say, it's just such an honor to get to know you over the past 5 years. And I think we have so much in common. One day we'll be able to sit down and have a glass of wine and talk with a little bit of time because we're always so busy. But it's great to see you. Of course, Adam Vaughan, who is here, my fierce colleague, who most of you will know, all of you probably know way better than I do. But my little story with Adam is I followed him around like a housing groupie for years. He didn't even know who I was. But I would pop up at these housing conferences and say, oh my God, Adam Vaughan, please talk to me. I want to talk to you about housing. So I was an Adam Vaughan groupie. I still am. And he's still just as passionate as those of you who would have worked with him in the city governance sector would remember. And of course, I don't know if James Mahoney is here, but if he is, a former Thunder Bayite and long connected through our roots, and just such a pleasure to serve with you, James, and to hear your expertise and your long-standing knowledge of your region and your area come through and everything you say. So I'm really thrilled to be here. And of course, Mayor Tory and Dr. Davila, who I feel like we practically work together now. We've had many, many conversations about substance use and health policy, and of course, COVID-19. And listen, you folks are doing a tremendous job with, I would say, in extremely difficult circumstances, and in particular, well, listen, everybody's working really hard, but nobody is working as hard as public health these days. So you all should be so proud and so grateful for the work of Toronto Public Health and Dr. Davila and her leadership. So thank you very much. And Councillor Joe Cressy, hello. I again feel like we know each other because we've been at so many events together, and I suspect we think a lot along the same lines about public health and about what creates healthy communities. So, and of course, Jason, I will not forget our roundtable at South Riverdale, where I felt so welcomed. And of course, I felt so familiar actually as I dare I say, still a drug policy activist, despite the fact that I'm now the federal health minister. None of this work ever is easy, and it requires a lot of activism at all levels. So I'm really thrilled to be here because this is really today the fruits of a lot of work and a lot of activism and a lot of compassion, I think, in the community for people who use substances. And at the end of the day, I don't think that we can solve any problem if we are absent of compassion in our solutions. And that's what I think about when I think about drug policy that respects people who use substances and that treats people who use substances as if they have value, which of course they do. And that is what has been absent, I think, for far too long, for decades and decades, from the way that we work with people who use substances and the way that we conceptualize substance use challenges, problematic substance use, and of course the supports and services that exist for people who want to be healthier and who want to live healthier lives. So I do want to also thank the Parkdale Queen West Community Health Center. I know that you're here today as well. And, you know, Toronto Public Health, South Riverdale Community Health Center, the Parkdale Queen West Community Health Center. These are examples of organizations that are doing that grassroots hard work of working to keep all people in the community healthy and safe. And your work has been exacerbated over the last year and a half with COVID-19, making it so much harder for people to come together, so much harder for people to leave their homes, so much harder for people to come face to face and get the services they need and the support and the kindness that they need in their lives. And you know, for people who use substances, that lack of ability to see each other, to use formal and informal peer support networks, has had a profound and a terrible effect on their lives. And of course, we're seeing that this public health crisis, which has been with us as Canadians for far too long. And we know that safer supply projects are a way to support people with opioid use disorder. They provide an alternative to the toxic illegal drug supply. Not only do they prevent immediate harm from overdoses, they actually connect people to health and to services, including treatment. They help people feel like their lives are worth it, you know, that someone actually cares enough to be talking about alternatives that are not simply just say no. Now, you know, it's funny, I used to run a shelter. I've told this story a million times and I apologize if I've told it to you, but I'm going to tell it again in case there are people watching today. You know, that there's so much stigma associated with substance use. And when I ran the shelter, oftentimes with new staff members who didn't understand harm reduction, who didn't understand things like needle exchange or managed alcohol programs, such as the one that I ran in Thunder Bay, I used to say, listen, you know, if someone takes that extra step to try and access safe supplies, it means they still have a desire to live a healthy life. It means that they still have hope for themselves and their families. It means that they care enough about their own health to be protecting it. And we have to shift our thinking as a society around harm reduction to reflect the fact that people who use substances still want to have optimal health. They still want to be able to protect their health and the health of their community. They still have hope for a brighter tomorrow. And we have an obligation as a society to treat them with respect, to treat people, all people, with respect, and to put into place tools that community members know are effective. It's community that knows what works. It's really not federal governments or provincial governments. It's actually community groups that are doing that hard work of connecting with everyday citizens who are living their lives in sometimes circumstances that we can't even fathom, that we may not have had the ability to see ourselves. And so it's very important that we support these kinds of initiatives that support people where they are, even when they don't want to seek what we would consider traditional treatment. And so it's my pleasure to announce that the Government of Canada is providing 2.3 million to support Toronto's Safer Supply project, providing injectable medication for people who use substances. And this is the first project of its kind in Ontario. Through this initiative, people with severe opioid use disorder will have access to injectable hydromorphone, and this is a service that's not currently available in Toronto. The project will be based out of Toronto Public Health's supervised consumption site, which is called The Works, and will offer a pharmaceutical alternative to the toxic illegal drug supply. In addition, I'm very happy to confirm that South Riverdale Community Health Centre will receive renewed funding, and the Parkdale Queen West Community Health Centre will also renewed funding, respectively 3.3 million and 2.1 million over 2 years, to extend and expand successful safer supply projects and allow them to continue to provide these critical services in the community. Now, I know, and I've heard from South Riverdale and Parkdale Queen West and other community-based organizations that the goal is to get to more sustainable funding. And that's what we're trying to drive towards here, is to try and provide some predictability around funding. And I wish that it could be longer. And I continue to work on making sure that we can actually fund organizations for longer runways so that you have that predictability and you can plan and support people longer into the future. We know that recovery takes time. We know that there are hundreds, if not thousands of people to serve, and that it makes it very hard for you to plan if you don't have that predictability. And that's my commitment to you as Minister of Health, that I'll continue that drive for that predictability that allows the continuity of services that I know is so important to you, but even more importantly, is important to the people that you serve. We know these initiatives are going to save lives. It really is about flexible treatment options and harm reduction options and treating people with compassion and respect, understanding that everybody's in a different place, everybody needs different kinds of supports and services, but that community organizations like yours are the best place to be able to determine what will help an individual in their time of need, in their particular situation. So I want to thank you, congratulate the City of Toronto for supporting your organizations to pursue these projects. And listen, I think that this is the right step for the city, and I'm so pleased to be able to support you at the federal level with this kind of progressive programming that's actually going to make a difference in lives immediately. Thank you very much.
And I think I'm to pick up off that, and Minister, first of all, to say thank you for being with us in Toronto virtually, and we'll look forward to more in-person visits as well. And I want to say thank you to the MPs who are here, because these are there's a whole group of MPs, larger than the one we have represented today. But I'm so pleased that Nate Erskine-Smith and Adam Vaughan and Julie DeBruzen and James Maloney could all be part
Nate. I forgot Nate. I'm sorry.
It's okay. Can all be part of this as well, because they're representatives of a team that is fighting hard for Toronto on issues. Some of them, ones that are more complex and difficult like this, other ones that are more straightforward, but they're talking to me each and every day. And I appreciate their support for the City of Toronto and for the people who live in the City of Toronto, who we all serve. I also want to acknowledge my colleague, Councillor Joe Cressy, who has been very helpful to me in having me understand these issues better. And does a good job as chair of the Board of Health, and of course our medical officer of health, who I'll introduce at the end of my own remarks. And welcome Maureen Gans from Parkdale and Jason Altenberg from Riverdale, who are doing such incredible work in the community, as the minister said, in the community. They're trusted by people, they're known by people, they know the people, and they are the best people to help us to try and address this terrible problem that is in front of us. This is an important announcement. It's not the biggest amount of money that's been involved in terms of things we're doing with the federal government in recent times, but it is necessary to save lives. We're talking a lot about saving lives these days, of course, in the context of the pandemic, but this is another preventable loss of life that we're experiencing in the city, and any loss of life is unacceptable. But this is, reaching proportions some time ago that should be, more discussed than it is. The pandemic has exacerbated the situation, as the minister said, in that there are more people who are alone because they're required to be alone by the rules, and various things that are contributing to things getting worse and not better. This is a huge, tragic, worsening, preventable health crisis. And it confronts people with issues in their lives that I can't even imagine. Thank goodness, being selfish about this, that I can't even imagine what it is like to have a dependency issue in my life. But I do know that what it is not a moral issue. It is not a legal issue. It's a health issue. It's a health issue. So what do we do, as in the pandemic, as with flu, as with a bunch of other things, when we have a health issue? We treat people, we support people, we love people, we respect people, we treat them all the same. I mean, our health system is built on the premise that every single person is entitled to the same care for whatever problem that they might have. And so I think that, and I think what we also have to do is make sure that we help our fellow citizens, our fellow residents of Toronto understand some of the issues that these fellow residents of ours are facing in their lives. And so this new funding will allow us to move forward, Toronto Public Health, to do things that will save lives. They will definitely save lives, but I think it'll also put us in a better position to do all those other things. It's a way of supporting people. It is going to put us in a better position to be able to respect them and care for them. And I think it'll help two of the projects in Riverdale and in Parkdale to carry on with the important work that they're doing, which was begun, well, it's begun a long time ago, but it was begun with this kind of federal support in fairly recent times. You know, if you look at the numbers, and it isn't about numbers, it's about human beings, but numbers, you know, tell a tale. 385 non-fatal and 26 fatal calls attended by our paramedics here in the city of Toronto alone in February of 2021. That's not a year-long number, that's 1 month. That's one, and a short month at that. We repeat that, 385 non-fatal and 26 fatal calls attended by paramedics for suspected opioid overdoses. Those are the ones they attended. These numbers are completely unacceptable. I don't think we would, in fact, I know we would not accept that anywhere, that kind of preventable loss of life. And there's no denying that these are preventable deaths. We've said many times during the pandemic that saving lives has to be our highest priority, and so it should be with everything else. And we do adopt that approach in many other areas where we say that our job in government is to save and protect people's lives. We're also seeing high numbers of people who are looking for services at our safe consumption sites, and COVID-19, as mentioned, has made the situation worse. So it's made it harder for people to access the services that they rely on, and it's made people more susceptible to drug use. And of course, this isolation has also made it more likely that they're going to get into contact with the kind of tainted drugs, if I can call them that, that this is meant to, in part, overcome. So I just want to say this is one more example, and I cite this all the time because I think it is just needs to be illustrated over and over again that when we work together as governments, in this case with the federal government and the City of Toronto, that the $7.7 million here is going to help us in the City of Toronto to save lives, full stop. That's what it's going to do. And what more noble, what more important task do we have as people who are in any different government? It doesn't really matter. Even just fellow Torontonians, we have an obligation to look out for each other and try and save lives. The experts are very clear in saying that safer supply saves lives. They're very clear about that. Toronto Public Health, Joe Cressy and Dr. Davila, in terms of helping to educate me, because I can't possibly know as much as they do about many issues, they've made that very clear to me as well. And I thank them for that because it's helped me to understand these issues better. And now what we need to do is to continue to work together. We can do better than we're doing now. We can do better. Those numbers are evidence of the fact that we can do better. We must do better. There is no question about that. And I'm determined to help to make that happen through personal leadership together with the federal government, and I hope to an increasing extent the provincial government, because after all, if this is a health problem, then it is principally the responsibility of the provincial health system. And we need to have more support in that regard as well. We need more investment in mental health and addictions. That is something I will be talking about in the context of any election that comes along, or just any public policy debate that comes along, because talk about an investment that will save lives, but it's also an investment, quite frankly, if that moral argument isn't good enough, that will pay huge returns to us in the context of saving that healthcare system from some of the agony that it goes through in trying to deal with people with inadequate resources. We need to devote more compassion and more respect and more support to people who have substance use issues in the City of Toronto. And this is going to help us to do that, just as we do with lots of other illnesses. In fact, we're still not anywhere near the kind of allocation of resources that we would be making if we were treating this the same as other kinds of illnesses. And I hope that today gives the people who are affected by this a degree of hope. I hope it gives the people working on the front lines, that two of whom are with us today, a degree of hope. And I hope that it gives people as well confidence that we are, those, especially those who are struggling, that we are trying to save lives, that we are trying to support them, that we are trying to do things that are going to allow them to get back on their feet, as the minister said, and get themselves back to a life that we would all expect for ourselves. On that note, someone who's working terribly hard on all of these issues, because all the issues go on, even in the face of an unprecedented pandemic. And somebody whose advice I've learned to respect. It didn't take a lot of learning; it just took a lot of listening. And that is our medical officer of health, Dr. Eileen de Villa. So, Dr. de Villa, as happens the case often at our media avails, over to you.
Thank you, Mayor Tory, and thank you, Minister Haidu, as well. And of course, thank you to all of you for being here today for this very important occasion, government and community partners alike. As you've just heard from the Mayor, and as you all know all too well, the COVID-19 pandemic currently has a grip on our city, our country, and indeed our whole world, all global communities. And we know that the effects of this pandemic are most acutely felt by those who are already vulnerable, those who have inadequate or insecure housing, those who have limited access to nutritious food or social supports, and of course, those with current health concerns and conditions, including those who are experiencing challenges related to substance use. And you've already heard the Mayor talk about this. COVID-19 has indeed, and the Minister as well, contributed to the other pandemic in our midst, the often forgotten pandemic that is devastating residents across our entire city, that being the opioid crisis. Throughout the COVID-19 pandemic, we've seen a sharp escalation of overdose deaths here in our city. And in fact, Mayor Tory just recounted some of the most recent and startling figures that we've seen in just a few months ago. And there really is, we know, no singular antidote to the suffering of the opioid crisis. But I can say that funding initiatives like the one being announced today, I do strongly believe will save lives. At Toronto Public Health, we are extremely, extremely grateful to receive the funding to allow for the provision of injectable opioid agonist therapy, or IOT, as part of our service offering at the Works. I can assure you that the implementation of this program will not only save people's lives by reducing individual reliance on an unregulated and dangerous drug supply, but will also, as you've heard now, connect people to much needed supports and resources in the community. The new program, in concert with other offerings that we provide at the Works at Toronto Public Health, and this includes such things as nursing care, referrals, outreach, naloxone distribution, and supervised consumption services. So all these services, the new program, and those that are offered by our many partners, some of whom are here on the Zoom conference today, all taken together, this will save lives. We've seen the impact of IOT in many other jurisdictions, Vancouver, Ottawa, London, Ontario, and jurisdictions all across Europe. So thanks to this funding, Toronto Public Health's The Works will now offer the first injectable opioid agonist therapy program in Toronto, and thereby introduce an innovative approach to the enhanced safer supply model. And this is a remarkable, remarkable achievement. Initially, the program will be able to accommodate about 35 people. And it is our sincere hope that with the availability of this initiative, that we'll be able to expand it over time. Now, more than ever, investment in this kind of program is crucial to saving lives in our city and to connecting some of our city's most vulnerable residents with life-saving health and social support services. So this also will, in addition to our current program, helps to provide a coordinated network across the city so that people at high risk of overdose can be matched with the appropriate program model to meet their needs. I know my colleagues at the Works work in close partnership with our colleagues, whether it's at South Riverdale CHC, at Parkdale Queen West CHC, and many other engaged community partners to deliver this network of services. And this funding really does support that. So I cannot thank you enough. We know that taken all together, this will significantly increase Toronto's capacity to meet the needs of people at risk of overdose. And again, it comes down to saving lives and improving the quality of lives. So today, I simply have this to say. Thank you. Thank you to our community partners, those here on the conference and those who couldn't be here today. But thank you to all of them for working tirelessly to care for our city's most vulnerable residents. Your work is so, so deeply appreciated. And, I just don't know that there's enough words of thanks to express that. Thank you to our government partners for supporting this work and continuing to champion it. And thank you to Minister Haidu, her team, and our partners in Health Canada for supporting the Safer Supply program in Toronto. So with that, I'll now hand it back.
Well, and I think that's a lovely note to end on, a thankfulness for such strong community partners who do amazing work every day and often unrecognized. So thank you, Dr. Davila, for ending on that note, because I think you might not see it, and we talked about it a bit before we started, but it's been a very hard year, and you've been working so hard and so diligently to support our communities. And this is a really wonderful opportunity for us to give that shout out. And thank you to all of the people who've joined us today. This concludes the official remarks, and we will be moving over to questions from the media. And I will be passing it on, but thank you once again. It's really an amazing day for our city to be able to continue this partnership.
Thank you. We will now take questions from media. Media wishing to ask a question may join the queue by using the raise your hand feature on Zoom. Once called upon, your line will be unmuted. Please include your name, media outlet, and to whom your question is directed, and limit yourself to one question and one follow-up. Should you have further questions or if you experience any technical issues, please contact the Health Canada and Public Health Agency of Canada Media Relations team at 613-957-2983. Again, please use the raise your hand feature to join the queue. Our first question is from David Thurton at CBC.
Hi, good morning, everyone. My question is to Minister Haidu. It's kind of off the announcement today, but I just wanted to know, Minister, if you could tell us anything more about the rare blood clot case we saw in Quebec, the first one following the use of the AstraZeneca vaccine. Are there any more details that you can share with us beyond that this is affects a woman?
Oh, well, thank you very much for the question, David. And I do hope that we will have some questions about the announcement today, because it is obviously critically important to so many Canadians. But I will just say that in terms of the rare event, it's important, first of all, to remind Canadians that these are extremely rare events, and that the value of vaccination is clear, that people who are vaccinated are safer, they are better protected from COVID-19, and that vaccines have two goals: to save lives and to stop the spread. Dr. Davila is here, so I may kick this over to you to say a few words, but in terms of this particular incident, I will just say that Health Canada, as a regulator, plays a very important role, and provinces, territories, in fact, local municipalities have requirements to report all adverse effects of any vaccination to through Health Canada, and the regulators are constantly reviewing the data and the evidence with their other regulator partners across the world, for example, the FDA, the EMA, and make decisions based on evolving evidence. And at this point in time, of course, we have specific requirements for the use of AstraZeneca based on ongoing review. Those requirements will change, and those use recommendations will change if there is any additional risk to Canadians that Health Canada determines is requiring a change in advice around use, and in fact in regulatory requirements around use. So I'll turn, maybe Dr. Davila, I don't know if you want to say a few words about this, because it really is your wheelhouse, but I will turn to you for a few moments.
Of course, Minister, and I think you've already spoken very nicely to some of the key points here. There's no question that the risks associated with COVID-19 far outstrip any sort of risks that might be associated with vaccine. And I think that when we hear about the incident that recently happened in Quebec, we're certainly looking forward to hearing more as the investigation unfolds so that we can inform ourselves. But I think fundamentally, this is evidence of the fact that the safety surveillance network is working, and it is actually doing its job to ensure that the vaccines that are being used in this country are appropriately approved and safe for use, and that the ongoing safety is constantly being monitored. And I think that's something that we should all derive a great deal of comfort from, knowing that we have these effective mechanisms in place to protect all of us and to ensure that we're all deriving the greatest benefit from vaccine.
Follow up?
Yes, thank you, Dr. Davila, and thank you, Minister Haidu, for that response. But I do think Canadians are wondering, was this person within that 55 plus age group? Was this woman, in a younger age group? So is there any more information that you could provide to us about perhaps her age, how soon after she got the shot did these symptoms develop? What sort of symptoms did they see? And if you can't provide that information, if you could just tell us maybe the reason why.
Well, thank you, David. And again, I personally don't have that information, and it's because people's medical health is protected, and people's medical information is protected, and people have a right to privacy. And so that's why that information is not available. But I will tell you this, the regulator is always, I think Dr. Davila said it perfectly. I think the fact that this information is transparent and that it's available and that Canadians have been informed of this incident indicates that the safety surveillance system is in fact working. And I will tell you as well that Health Canada will continue to be transparent and clear with Canadians if advice changes. NACI, as you know, the National Advisory Committee on Immunization, is transparent with their information. The information is posted online as it changes, as it evolves, in a variety of different formats and clear language formats for people who are not researchers and scientists, and in detailed data form for people who are. So I would just be, I'm very confident that Canadians will get the information they need to stay safe. And I will just remind Canadians that the vaccines are indeed saving lives. So when it is your turn, please accept the vaccination. You are protecting yourself and you are protecting your community.
Thank you, Minister. Our next question is from David Ryder, Toronto Star.
Hi, everybody. Thanks for this. I'm hoping, Dr. Davila, you could elaborate a little bit on the 35 people in the program, just a little bit about how it's going to work. And because there is such a kind of catastrophe in the background of a global catastrophe, what concrete impacts you think it could have for preventing overdose deaths in Toronto?
So thanks, David, for the question. I think that, the simplest way to characterize the program will be that, each individual always undergoes an assessment, and you have to understand what the unique circumstances are. And there are going to be individuals, and we know we have actually done some of this work in advance and have appreciated that there are some of our clients for whom, the benefits of injectable opioid agonist therapy or this type of managed opioid program will actually be extremely beneficial. In fact, when you look at the evidence that's out there in respect of managed opioid programs, it's this type of program that actually has a great deal of evidence behind it in terms of supporting people's ability to stay safe and to indeed save lives related to substance use and challenges related to substance use. So we are unfortunately only able to offer it at this point in time to 35 individuals. There will be a very significant evaluation component to this. And of course, our work is always done in partnership with our community partners. So we do have options in this program where they can either come and have the medication done in an observed way with us in our program or through a community-based pharmacy. We're offering a little latitude to clients, again, depending on what their unique circumstances are. And we're hopeful to see that we are conferring benefits, that it is allowing for opportunities for our clients to better experience good health and to connect with other important social services. That will be determined through our evaluation. And the sincere hope is that we'll be able to then scale up and offer this life-saving service to a greater number of people as funding becomes established over time. That's certainly our sincere hope, David.
Paula?
Thank you. Yeah, my follow-up is about vaccine supply, and we see some of the health partner clinics being canceled, either in whole or just some people's appointments being canceled, especially in Scarborough. And we've seen some of the people involved in those clinics saying that the supply, they're pointing the finger somewhat at Toronto Public Health, saying maybe they're not providing enough, but also obviously federal government is key to supply. So I'm hoping maybe Minister Hajdu and Dr. De Villa or Mayor Tory, anybody that wants to, can talk about the supply issue for Toronto, and are we going to get enough supply that those appointments, those people can quickly get vaccinated who, you know, had a glimmer of hope and now being told you're going to have to wait.
So why don't I start off, and I'll see if the minister or the mayor would like to add further to the answer. David, you know, I did hear about Scarborough and their unfortunate vaccine supply issue. I can tell you that we have worked hard at Toronto Public Health, and in fact, with all our vaccination partners across the city, to do whatever we can to support them. Unfortunately, the vaccine supply issue isn't about us. It's actually a much larger issue. There are challenges. We've seen other communities in the province also having challenges with vaccine supply. Some of which is related to some delayed delivery as we understand it. You know, these things, I guess, happen. We know that the vaccine is in great demand globally, and, you know, everyone around the world is trying to get more and more vaccine supply. And this certainly puts, you know, demands that are oftentimes, I guess, difficult for vaccine manufacturers to meet. But we are certainly making every request to our provincial counterparts and making sure that they're aware of what the challenges are here on the ground. I would say this, again, the Toronto vaccine partners have worked very hard. All of our vaccines at Toronto Public Health are actually spoken for. Our clinics are full. So unfortunately, we don't have anything to share, but whenever we do, we have made sure that we provide those vaccines to our partners as quickly as possible. And I know I can say the same is true for our other vaccine partners. Should they have supply available and there are other partners in need, we have worked hard to share across the city so as to try to avoid, you know, the cancellation of clinics and other unfortunate events related to supply.
Well, I'll jump in and thank you, Dr. De Villa. And first of all, I'll just say, listen, I understand, and it's a great sign that Canadians want to get vaccinated, and the volumes that we're seeing trying to book appointments across the country, making sure that when it is their turn, they're stepping up to make those appointments, helping each other to make those appointments in some cases. And I had the pleasure of going to, just before the province-wide shutdown, I had the pleasure of going to the Thunder Bay District Health Unit's vaccine clinic here in Thunder Bay. And I have to say, public health is working so hard to have these organized clinics that people are safe in, that are moving smoothly. And it is local public health that we have to thank. They're doing the heavy lifting on all of this. So again, thank you, Dr. De Villa, to your team. And I'm going to take an opportunity to thank Dr. DeMille here in Thunder Bay, just because I have an opportunity to do that. And of course, across the province, people are working equally as hard. I'll just say, listen, I just looked it up on the table while you were speaking, because we actually published the deliveries that we've received into Canada and the forecasted allocations across the country on the PHAC website. So you can just Google vaccine allocation, vaccine, you can do, you know, Canadian vaccine forecasted allocation. It'll come up, and it is on the Canada COVID website. And so I know, for example, by looking at that website, that we've received well over 11.3 million vaccines into the country at this point. 4.5 million of those have been delivered to Ontario. And we have forecasted deliveries over the next several weeks of, you know, 400,000 a week of Pfizer alone to Ontario, and of course Moderna in the next couple of weeks in lesser amounts, but still nothing to sneeze at. 28,000 this week, 42,000 the following week. And Dr. De Villa is right. I think the challenge is, and you know, Pfizer has turned out to be, after their delay in January, January, if you recall, where they actually did slow down in production in order to boost their capacity, has been very reliable. Other suppliers, of course, are doing the same thing. They're trying to refine their processes because, as Dr. De Villa pointed out, the entire world is working to get these vaccines into their country as quickly as possible. And so manufacturers, I think, are working diligently to try and increase capacity. And Canada has, I am very grateful for, a very diverse portfolio. So we have a number of different pharmaceutical companies, as you know, that we've got contracts with, and we're going to continue to push for clarity on those delivery schedules and commitment to meeting those delivery schedules so that the planning efforts at the local level can be as smooth as possible. Because I think that is, the challenge for the local level is if there are disruptions in delivery, the planning then has to be rejigged to adjust for the volume that they are told they're going to get. But I'll also say this, again, I think it's an all hands on deck moment. Everybody is working incredibly hard right now to get vaccines into the country, to distribute them amongst, the regions in each province and territory. And then finally at the local level, the real heavy lifting of planning, coordinating, sequencing that vaccination. And I want to thank, again, the local public health units that are doing the heavy lifting on getting vaccines in arms.
Thank you, Minister. Our next question is from Brian Passive from Toronto Sun. Brian, you should be able to unmute your line now.
I apologize about that. Can you hear me now?
Yes.
Oh, sorry about that. Just to piggyback on David's question a few minutes ago here, Dr. Jennifer Kwan last night on Twitter tweeted about a 1.2 million vaccine shortfall between what's been delivered to Ontario and what's been administered. With that amount of vaccines supposedly sitting in a freezer somewhere, can anybody say why exactly tens of thousands of vaccine appointments have been canceled in the province or in the Toronto area?
So Brian, thanks for the question. I certainly can't speak to the entire supply of vaccine in the province. What I can speak to are the doses that are within the purview of Toronto Public Health, and those are the doses we use for our mass immunization clinics. We are completely, they are all allocated. We have clinics booked, they are fully booked, and every vaccine we have is available for use, and we are using them specifically for those clients, and we time them in accordance with when the next delivery is. So we have no unaccounted or unspoken for vaccine doses. I can't speak to what's happening in the rest of the province, but it is my understanding that vaccination partners around the province are allocating and booking appointments to the best extent possible, in keeping with what their anticipated supply and delivery of vaccine looks like.
Maybe I'll just piggyback on that, Dr. De Villa. Thank you. Obviously, at the Public Health Agency of Canada, we are being transparent with Canadians about what vaccines have arrived in the country and how they've been distributed to provinces and territories. And that transparency, I think, is critically important to Canadians because, of course, Canadians are following along. This is very important to everybody in every community across the country. And so I think the more transparency that we can have in terms of how vaccines are being distributed federally and certainly provincially, the easier those questions are to answer for reporters, but also the easier those questions are to answer for local public health units that are working so hard to get that clarity of delivery schedule.
Paula?
Okay, thank you. My second question is for the health minister. I'd asked this question last week of the transport minister, but his staff forwarded my question onto your office. So far in April, we've seen 29 flights arrive in Canada from Delhi carrying passengers that have tested positive for COVID-19. Given the recent news about the newly identified double mutant variant that's helping fuel India's tragic and devastating second wave, has there been any talk about restricting or even stopping flights from India, similar to the previous measures taken against flights from the UK or Caribbean vacation destinations?
Well, thank you very much, Brian. And as you know, we've been adding layers of protection at the border since the beginning of COVID-19. In fact, we have some of the strongest measures in the world, and all passengers are now required, as you know, to submit to a pre-departure test, a post-arrival test, wait in a hotel that is specifically approved by PHAC to quarantine people until they get that result, then return to their place of residence after they receive a negative result, quarantine for the rest of their 14 days, submit a test on day 10, and that is for regardless of which country. The challenge, Brian, with country by country approaches is, of course, COVID spreads in ways that we can see and ways that we can't. Some countries are doing genetic sequencing, others aren't. And the safest thing for Canadians is to have a universal approach that requires the scrutiny at the border. I'll also say that there is a very low rate of importation. It's 1.1% of Canadians that are testing positive. That's nothing. That's not nothing, Brian, but it is way lower than the community transmission rate that I think reached about 10% in Ontario yesterday, approaching 4.5% in Quebec. And I guess my point with this is we will continue to do our part to prevent importations of COVID-19 into Canada. But COVID-19 is present and clearly a danger to Canadians in community. And we have to stay focused on making sure that we're doing everything we can to support people who, first of all, from contracting COVID-19, but then, of course, those folks that are positive with COVID-19 from spreading it to their families and their communities. And that's the really hard work that has to happen at every level. And of course, Dr. de Villa is critically acquainted with how hard that is. And so it really is an all hands on deck time, Brian, for Canada and for Canadians. We'll continue to do our part at the border to make sure that we are aware of travelers that are sick and that we're properly isolating them so that we don't add to the burden of cases in community.
Thank you, Minister. Our next question is from Cormac McSweeney, Cine News.
Can you hear me okay?
Yes.
Okay, wonderful. Hi, Minister. My first question is for you. You mentioned it yesterday in QP and this morning as well, that Health Canada would not hesitate to either pull AstraZeneca's license or change its advice for the vaccine if there are risks determined by Health Canada beyond what we already know. Is that a suggestion? Because we have a briefing coming up here in about an hour that Health Canada is going to change its advice on this, or are you simply saying that to try and reassure Canadians that Health Canada is on top of this? Can you provide some clarity as to what you mean by that?
Well, I'm reminding Canadians, thanks, Cormac. I'm reminding Canadians when I talk about the Health Canada regulatory approach that this is a very strong regulator. It's independent and they work on an ongoing and constant basis with provinces, territories, and indeed right down to the local level of public health units to monitor the safety of the vaccines that are in use. And they won't hesitate to change their advice if in fact the research and the science and data suggests that it needs to be changed. We've seen that advice change, Cormac, with AstraZeneca through the work of NACI as well, who provides advice to provinces and territories based on their ongoing monitoring. And again, this is the process that Health Canada continues to pursue as their commitment to the safety of Canadians. And I'll just say this, again, I think Dr. de Villa said it well, and Dr. de Villa, you may hear me repeat your words because they are really wise words, that the risks of COVID far outstrip the risks of the vaccine at this particular time, that the safety surveillance network is indeed working, and that when we see reports of adverse outcomes, that means that everybody is doing their job. Everybody is watching for these adverse outcomes. Everybody is monitoring the adverse outcomes and the side effects that may include even minor side effects. Sore arms, for example, are reported through this surveillance network so that we at the federal level have the data we need to continue to make recommendations and indeed change recommendations of use if necessary.
And as a follow-up, I know it's been sort of asked before, and this is for the minister, but if Mayor Tory or Dr. de Villa want to jump in, that's fine. Given the issues that we've seen in Ontario with people 18 plus in hotspots being open to book, teachers as well being added on to the other age groups that are already available, we're seeing, a lot of confusion, a lot of people not getting through to book their shots. We're now seeing these clinics in Toronto having to cancel thousands of appointments. To put it bluntly, Minister, should provinces be opening up eligibility beyond what their vaccine supply is or beyond what their systems can even handle?
Well, maybe I'll start and then I'll turn to Dr. Davila and I'll say, listen, here's what we know about vaccination. It has two really key important roles. One, to save lives. And you can see that in the early stages of vaccination, the focus was very much on that goal. It was about making sure that, for example, elderly people in long-term care homes and healthcare workers in long-term care homes who are most at risk of contracting the virus and dying were prioritized. Now, as the vaccine rollout has moved into stage 2 in Ontario, for example, priorities have shifted and changed, and public health units also have the capacity to determine how best to reach not just that first goal of saving lives, but the second goal of vaccination, which is to stop the spread. And I point to my own community in Thunder Bay that has done an enormous amount of work, both on the health protection perspective of public health measures that have really brought down our exponential growth in the earlier part of spring, but also on the work of immunization to help slow down the spread. Listen, vaccination is one tool. It's a very powerful tool, but is one tool in our toolbox of managing COVID-19. And we have to remember that less COVID, no matter how we arrive at it, is safer for everyone. So I'll turn to Dr. Davila to talk a little bit about how they are choosing priorities and how it is with one goal in mind, which is to protect people from contracting COVID-19.
So thanks, Minister. I would agree. Again, the objectives of the vaccine program are to mitigate the negative impacts associated with COVID-19 and to address those who are at greatest risk of negative outcomes, and as well to focus on those areas where transmission and incidence is the highest, over and above trying to manage or mitigate hospitalizations and deaths. And there's no question that we want vaccines to be broadly available and for everyone to take up vaccine as soon as is possible. However, we do have some supply challenges. We've spoken about that through some of the earlier questions. So in light of those particular supply challenges, the idea then is to provide those vaccines and to use the resources where they can deliver the most value in the shortest amount of time. Hence, we focus on those populations at risk, as the minister has rightfully pointed out. And we also focus on sort of hotspots or areas where there's a lot of COVID-19 activity. As supply opens up, by all means, I think we want as many people to get vaccine as soon as that supply becomes more readily available and as soon as their eligibility or return comes up. But in the meantime, exactly as the minister said, vaccine is an important tool. It is but one. So for those of us who are in a high transmission area, not only should you go and get that vaccine as soon as your turn comes up, but as well, even after you have your vaccine, and as you're waiting for your vaccine, it's still really important to engage in those measures for self-protection. We know that keeping distance to the greatest extent possible really does reduce transmission and will help provide that opportunity for vaccines to be as effective as possible, as quickly as possible.
Thank you. We have time for two final questions from the queue. Our next question is from Brian Mullen, Global News.
Hi there, thank you. My question is for Minister Haidu. Minister, fewer than 1/5 of Canadians have their first vaccination. We are outpacing the US now in per capita coronavirus cases. Adults are being cared for in children's hospitals. Frontline medical workers are pleading for their second dose. Despite all your efforts, critics are saying that your vaccine plan has failed. How do you respond?
Well, listen, I will say this. We anticipated having 6 million doses in Q1, and we blew through that goal, and in fact, it landed at 9.5 million. We now, as I pointed out, have brought 11.3 million doses into this country. We are working around the clock to accelerate shipments with manufacturers that, by the way, every other country is working around the clock to accelerate shipments from. And we'll continue to do that hard work. It is about trying to get as many vaccines into the country. But I will also repeat what Dr. Davila has just pointed out, and I think what we're seeing around the world. That vaccine is an important tool, but it is not the only way that we can control the spread of COVID-19. In fact, we need to protect the gains that we're making by ensuring that we continue to have appropriate public health measures in place and that we support people who are most at risk of infection. If we look at, for example, some of the hardest hit regions in Toronto, which I, Dr. Davila, also keep my eye on just because of my public health background, it is in regions where people don't have the option to work from home, where they are working in crowded situations, where they are living in crowded situations. And so we have to continue to support people to protect their health, to protect the health of their families while we do this critical work of vaccination. We can't take our eye off the ball of preventing COVID with the other measures that we know is working.
Thank you. And as a follow, given this punishing third wave, what more can be done to speed up vaccinations, or is it just a matter of having to wait for more deliveries?
Well, listen, I would want to first of all say that we are doing everything in our power day and night to turn over every rock to discover, other sources of vaccination. But again, I'll just repeat, COVID-19 it has proven to be a very wily foe for all countries. And when I look at some countries that have had incredible success with vaccination, and yet are seeing surging rates of COVID-19, I think that should be a cautionary tale to us all. Vaccination will work, but we have to reach a critical mass of people vaccinated before we can alleviate public health measures. Way back at the beginning of the pandemic, there was modeling presented by the Public Health Agency of Canada that said if we release our measures too quickly, our protective measures that will help us reduce the spread of COVID-19, we may see a greater surge. And in fact, that's what we're seeing across the country is surging cases of COVID-19. And, many public health experts will say to you, we cannot vaccinate our way out of this. We actually have to vaccinate and continue to prevent the spread of COVID-19. And I'll repeat what I said earlier. The safest scenario for any Canadian is no COVID-19 in your community. Less COVID-19 means you're safer. So vaccination is a tool to get there, but we also have to be applying those other public health measures as we vaccinate people so that we can stay ahead of the virus.
Thank you. Our final question is from Colin Cote-Palette, Radio Canada.
Hey, hi everybody. I know some of you are speaking a little bit of French, so I was wondering if we could get back to the local issue here, the opioids. If you could give me some comments in French, like anyone that can do it, you can say like whatever, you can summarize or say it can save lives, whatever.
Peut-être je peux essayer. L'annonce aujourd'hui, c'est très important pour les résidents de Toronto. Les personnes qui consomment des drogues doivent avoir les services qui that work for them. I apologize. And that are compassionate. Maybe Julie, you can take over for me because my brain on French and Zoom is not working.
C'est à juste dire qu'aujourd'hui, c'est une bonne journée parce que c'est quand nous avons un partenariat entre le gouvernement fédéral, notre ville et puis nos partenaires en communauté pour sauver des vies. C'est quelque chose où nous avons pas seulement un investissement, mais un appui continu entre le gouvernement fédéral et la ville et nos partenaires dans la communauté, comme South Riverdale Community Health Centers, où on va aider à sauver les vies des gens qui utilisent les drogues. Et alors, si vous avez des questions un peu plus techniques, mais c'est juste vraiment pour démontrer qu'on peut travailler ensemble et quand on travaille ensemble, on sauve des vies.
OK. Et ma question de follow-up pour vous, quand vous parlez des programmes, on parle vraiment des 2 programmes qui sont étendus, là, qui sont des programmes pour donner gratuitement des opioïdes qui sont sécuritaires. C'est vraiment ça la clé ici.
C'est bien ça, c'est un programme continué pour avoir des opioïdes qui sont pardon, parce que ça, j'ai perdu mes mots. C'est aller entre les 2 langues, ça peut être un peu difficile de temps en temps. Mais c'est qu'on continue des programmes où on a démontré qu'on sauve les vies. On a démontré qu'on peut travailler ensemble et que même pendant COVID, et ces pandémies dont nous parlons à tous les jours, nous avons aussi un problème continu où on perd des gens dans nos communautés avec les opioïdes illégales et comme ça, avec donner un safe supply, on peut aider les gens et continuer à démontrer qu'on peut travailler ensemble pour sauver ces vies.
Thank you. Merci.
Thank you very much. This concludes today's press conference. Thank you very much for joining.
Thank you very much. And thanks, Julie, for jumping in and doing the French for us. Merci beaucoup. Au revoir.